And then, but also yoga is also not mentioned in all Brihadrayis, for example. The practice of yoga, like Hatha yoga and all of that. So, what about that then? Should we include that in our treatment principles or no? Because I have heard one Vaidya telling that yoga is not related to Ayurveda at all. And
See,
yeah.
that's
So,
a
what is
different
your thought?
science. Yeah, we need
Ah.
to limit ourselves. So it's not necessary that if I'm a BAMS
Hmm.
physician, I have to know yoga, I have to know Ayurveda,
Hmm.
I have to know
Hmm.
naturopathy, I have to know acupressure, acupuncture, everything, hydrotherapy, everything. It's not necessary. We have to
Not
focus on
necessary.
certain things. In my practice, I prefer not explaining all these things. Like patient come to me, while leaving, they ask me, won't you suggest any asana, yoga,
Asanas, huh?
pranayam, anything like that? I
Hmm.
suggest them to see some other yoga therapist or anything
Hmm.
like that. Even dietary regimes or the
Hmm.
pathya, I prefer not to tell
Oh.
because my idea is that the patient shouldn't lose his staple diet because with
Hmm.
medicines he may come out of the disease, but
Hmm.
after he becomes well, his body may not accept that particular diet which he used to take previously. So he has
Yeah,
to
I've
be
noticed this. I've noticed
he
this in my
has to
patients as
be
well.
he has to keep his body favorable for the staple diet which he had been taking. That's what I prefer. That's why
What if
what I
that
take care.
staple diet was fully
Then it has to be
apatya?
changed.
What if that
Then it needs to be
uh,
changed. Yeah.
it needs to be
If it
changed,
is
na? Because I
absolutely
have
hmm.
hmm, sorry, I'm so sorry to cut you off. Because I had patients who were lot of like apatya and everything, or only
Hmm.
ekarasa pradhana ahara. When I've
Hmm.
asked them to change and everything, but I have noticed the patients coming back after like 6 months of treatment or something like that, telling I'm
Hmm.
not able to digest the bahar, like the junk food.
Hmm.
I've
So
noticed
it is
this.
needed. Whenever it is needed, it should be done. If it is not needed, it shouldn't be done. So I prefer not being a dietitian. I prefer not
Hmm.
being a yoga teacher. I prefer not being a
Okay.
acupuncturist, acupressurist. I
Uh,
even prefer not being a Panchakarma specialist.
oh, me too. Same pinch.
So,
Same pinch because
so
I, being MD in Panchakarma, like they asked me, no, like why aren't you practicing that? No, I won't.
hmm.
I see that till I won't.
Yeah. So
Yeah,
I prefer being a specialist in one particular thing
yeah,
than being like than having a little knowledge of everything. So
everything.
it is better to know one means if you see Ayurveda Samhitas, there is no yoga mentioned in it. And it's correct. If
Yeah.
anybody is saying that yoga is not a part of Ayurveda, it's not 100% false. You can use it.
Mm.
You can use it as a helping hand. Is something that helps in your treatment. You can use it, but you can't say that it's part of Ayurveda. Actually, naturopathy has become like means people come to me and say we have been to that Ayurveda center
Yeah, yeah.
where they give mud bath, where they give that water and
Mm.
they give salads and all those things. And I have to
Yeah,
tell them
yeah,
it
yeah.
is not Ayurveda. So
Correct.
anything that is natural, that means I tell them that naturopathy is German. It is not even Indian.
It's not even
So,
Indian, correct.
so that is far. But even with yoga, I keep telling people that just because it is related to Hindu philosophy, you can't say that
Mm.
it is Ayurveda. It is
Mm.
different. It has
But
different
we can
way of
use it,
using.
na?
Of course, we
We
can
can
use it.
use it. Huh?
Yes, of course, we can use it. But like it is not part of Ayurveda. Ayurveda is different. We
Mm.
have to segregate these things. We have to understand
Exactly.
first what is Ayurveda,
Understand.
what is this what is yoga, what is
Mm.
asana. It's not even yoga; it is asana.
Asana.
After doing after means out of Ashtanga of yoga, it is one part.
One
So that is
part.
different. We need to understand we need to know that these things are different. We can use anything that helps in treatment,
Mm.
but we can't say that it is helping us. That's why it is a part of Ayurveda.
Exactly. Right. Right.